Joining us now is nurse Nikki, and we're going to be talking about plastic surgery. Welcome to the show. How are you?
Hi, Donna. How's it going?
Fabulous. What made you decide to become a nurse?
Well, I want to say a long time ago, my mom actually, she's a retired nurse. And as a kid, I would watch my mom get ready for work and wear her uniform and come talk about these stories. And then as I got older, in high school, they had a vocational program called Health Occupations. And my mom said, try it out, see if you like the medical field. And then from there, it's always been my love.
So where did you become an RN? What was the schooling that you had to go through for that to happen?
So initially I was in vocational school and I actually did LPN first. And then what I did was I did a accelerated program online where you were able to do the LPN to RN bridging. And I did that with West Palm. So it just happened kind of throughout working and learning at the same time. And here I am today.
And just striving and thriving.
Yes, thriving.
Yeah, just thriving. So where you are now, you're almost like a patient advocate, if you will.
Exactly.
To help someone, kind of explain to them the process.
Right, exactly.
Why do you feel people are afraid of plastic surgery?
Because there has been some bad plastic surgery out there.
Okay.
Unfortunately, we hear a lot of stories. And what happens is a lot of people, they're interested in changing something, they want to do a type of procedure, but they just don't know how to go about it or who's telling them the right information. So nowadays, people are just afraid because they just don't want to make the wrong decision.
And NYC Plastic Surgery, what are some of the procedures? Because I looked in it, you do a lot of things. What I was surprised about was how can you help people with hair loss?
Yes, so we have something called hair restoration, which you have two options. There's something that's non-surgical, where we take your own blood and we inject it into your hair follicles. And that's what's happening is the hair follicles become alive again. The collagen stimulates, and you start to see hair growth probably after maybe 2 or 3 sessions. It's actually really good to do, even as a preventive measure as well.
Now, is that PRP? Is that what that's called?
It's
like cycle it around or something?
Exactly, yes, the PRP.
Interesting.
Yes.
So that's one of the things that you do. What are some of the other fun procedures?
So we also do liposuction, which gets rid of stubborn fat. We all have something where no matter what we do, we diet, we exercise, we starve ourselves, it doesn't budge. So the liposuction is fun because it's minimal invasive. The recovery is like 2 days. It's a bloodless procedure. A lot of people get afraid of blood, and the recovery is very easy.
Okay. So liposuction, there's not an incision?
There is an incision, but the incision is like the size of a tip of a pin. It's very laparoscopic.
Are you kidding me?
Yes, it's very laparoscopic. You'll probably have about 2 or 3 of them at most, and they're hidden in like really discreet areas where you have natural creases and folds. So no one won't even be able to tell. They'll just think you just got a personal trainer for the winter, and here you go.
There you go. What is like one of the most successful procedures that you've seen happen where someone has had a life transformation?
Yes. So it was interesting. I had a client. She had a dramatic weight loss. She weighed about 300 pounds and she did the weight loss surgery. And after the weight loss surgery, there's a lot of excess skin that a lot of people have. And it's a process and people know that you're going to have to eventually get it removed. So she came in and she was crying and she was just like, I just want to look different. I want to look in the mirror and like what I see. And we wind up doing a full body lift where we did her upper body, we did her thighs, we did her arms, we did everywhere. Also too, it encouraged her to stop smoking cigarettes because that's a big surgery to recover from. So just seeing how she is now, and she had a birthday party and she showed us a video of her singing in this white dress. And then she just looked like she was just happy and she was herself now,
Recently on social media, I saw a gentleman that had gone through a life, transformation.
Mm-hmm.
And that's exactly what they did. And he looks like a completely different person.
Yeah.
Super healthy now. He's glowing, he's smiling,
Right.
he's living his best life because, especially when you're pushing that 360-pound type of body.
Exactly.
It's just, sometimes you need some help. And then once you work it off, you have too much skin.
Yes.
So it's great to know that there are solutions for people out there
Yes.
to help them
absolutely.
gain more confidence. Also scarring sometimes, right? Like from plastic surgery, sometimes what can people do to kind of maybe reduce some of their scarring?
So a lot of times I believe scarring happens because people are not doing the preventive measures.
Okay.
So one is making sure that you're really cleaning those areas. You're really using some antibacterial soap to get any like the gunk that sometimes builds up. rinse it very well, pat it dry, and use creams. You can use aloe, you can use cocoa butter. There's different things that you can do. And then also too, if you're someone who may have skin to keloids, there are injections that we can do in the
Really?
office to come and, maintain and make sure that everything heals properly. So
Yeah.
there's so many different things to do, but you just have to stay on top of it.
Okay. And yes, keloids, sometimes what it is, it's the scar tissue, but it kind of raises up.
Because you're healing so rapidly that it's not giving the skin a chance to smooth out. So
Oh,
that's why it keloids up. And then when we put the steroid in, it makes it go back down and
calms it
smooth
down.
again. Yeah.
I love that. I love that you're helping people with that. Nurse Nikki, thank you so much. I truly appreciate you being
Yes.
here.
Thank you for having me.
I learned new things. Like all day today, I've been learning new things.
Yes.
I hope that you've been watching some of the other segments. It's fun here, right?
Yeah, it is.
And please, don't hesitate to come back.
Yes.
So
I would love
I
to come back.
appreciate you,
Thank you.
especially
Thank you
with
for
the
having
hair
me.
loss, because that's a lot for people.
Yeah,
sometimes.
and it's very something simple and straight to the point, so don't be afraid of cosmetics procedures. I'm a consultant here to make sure that I give you the right information, help you choose the right things for you, what works best for you, and just have you go on your journey feeling happy and good.
Thank you so much.
You're welcome.
Stay tuned for more. We have been living it up right here with Nurse Nikki.